Okay, my name is Nilo, and this is my ID. This is my home, and this is where I'm going to perform some skills. Okay, and this is the table where I'm going to perform my skills. There's my supplies that I'm going to use. Okay, so I'm going to first. We're going to insert an NG2. We're also going to administer some gastric tube feeding. We're going to administer a tube feeding, and we're going to administer a tube feeding also by the with a large syringe open system, and administer medication and also remove an NG2. Okay, so first I need to check the orders. This is my patient's chart. So I'm going to first check the orders and make sure that we have the right size of NG2. Okay, and we gather all of equipment, and I perform hand hygiene, identify the patient, name, date of birth, and I use their ID to make sure that it matches. Once we do that, okay, then I'm going to explain the procedure to the patient, make sure they understand any how they're gonna feel, if they have questions, or they're gonna need any interventions, then we can take care of that. And if they have questions, then we answer the questions, okay? So once we do that, we assemble all the materials, we provide privacy, everything's already organized, and we need to measure the tube and how much is going to be inserted. So we need to get the tube, the NG tube, and we need to measure from the tip of the nose to the earlobe to the siphon process. Once we do that, and we need to use a marker and mark it, okay? So once we already know where it's going to be, now I can put on my gloves. Okay, so put on my gloves, put on any PPE if we need to. There's my mask and gown, whatever I need, the coats. So once that's done, then I'm going to apply some this lubricant into like 2 inches of the tube, so that when it goes in, so it's no problem, okay? So then we need to choose what nostril we're gonna choose, and insert up and back to the pharynx. Then I'm gonna provide some water to the patient, and so that he can sip with a straw, okay? And so when it's gonna all go up and back, when it reaches the patient is gonna be flexing back. So once it reaches the pharynx, then the patient is gonna go have chin to chest, and then it's gonna be down and back, okay, down and back, so until he reaches the stomach, and we see the mark in here where it's supposed to be in the nose. So once we do that, and everything's there, right, then we're gonna check the placement. But before, let's say for example, if there was any resistance, then I need to check, or the patient's gagging, I need to check, and I can use a tongue blade, and I can use a flashlight to check for the, if it's curled, then I move those things, right? If it's curled, then I move that, and straighten it, and continue. All right, so then I can continue. And if it's all the way there, then we need to check if it's in the right placement. So once it already reaches that point here, then I can put on a little bit of tape right here on the cheek, so that when we can check it, okay, in the meantime. Once we check, how do we check? We need to aspirate. So we aspirate, and we need to put 1 drop of that into the paper, pH paper, and compare 30 seconds later to see if it is at least less than 5.5. So let's say this is the paper, so we check, okay, it matches, is less than 5.5, so then we're done with that one, okay? So I'm going to put this away. So now we visualize, so we look at the contents that we got aspirated here, and we check for color consistency. If it's like greenish, then that means that it's the gastric contents. Okay, so once we do that, and it is already confirmed, so now we can cut, 4 inches of tape, and we cut 2 inches and the part that is not cut, we attach it to the nose. Okay, and then the other one is gonna be wrapped around the NG tube, both of them, around the NG tube, and we put another piece over here in the cheek, and then have the patient turn side to side to make sure that we have enough room. So once we know we have enough room, then we can pin it. So we use this to pin it to the patient's gown, okay? And the vent needs to be at the shoulder, okay, at the shoulder. If it's a double lumen, then that lumen, then it's gonna be to the stomach, okay? Or the saline is used, then the vent should be above the stomach. Okay, so then once we do that, remember to clamp the, we have this one, clamp the tube, okay? Remove the syringe, and we need to now cap the NG tube. So once we've done with that, now we need to ask, we already secured it and everything, we need to provide oral care to the patient, and if they need the lubrication for the nose, they're gonna need this 2 to 4 hours, okay? So we need to have this for the patients, for them to use every 2 to 4 hours. All right, so once I'm done with that, I can remove my gloves, okay? Go away in the trash can. And I can now lower the bed, okay, put the patient comfortable, remember the 4 P's, position, potty, proximity, and pain. And lower the bed, the side roll up. This bed, we now need to clean up this overbed table, clean, remove all the equipment and materials. I remove any PPE if I used, okay? And I need to perform hand hygiene and document the procedure and how the patient tolerated the procedure as well. Okay, so now I'm gonna be administering a tube feeding. So what we're gonna do, we're gonna check the file again, okay, to administer a tube feeding, and we need to gather the equipment that we're gonna need. What are we gonna need? Well, we're gonna need some formula, okay, I need to check what type of formula it is, the concentration, the amount, the time, and the frequency, and I need to check the expiration date on the formula. Okay, so then I need to bring that to the patient's room, okay? So I perform hand hygiene, I need to identify the patient, okay? And once I identify the patient, I need to explain the procedure. I explain what we're gonna do, and after all of that is done, I need to provide privacy. So I organize all the materials here, okay? I'm doing an abdominal assessment, so I'm gonna check with my stethoscope and check for bowel sounds. Bowel sounds are present. So once we know that bowel sounds there are present, now we can elevate the head of the bed to 30 to 45 degrees position, and which is like eating, when they're gonna eat, right? And then I need to remember to unpin. So I'm gonna unpin, and I'm gonna need to measure, okay, so use the measuring tape to measure the length of what is exposed, and also to make sure that the mark is right there where it was supposed to be. Okay, so now we're doing that. Let me check. I need to attach the syringe, okay, because I need to aspirate stomach contents. So I'm gonna come and I'm gonna attach this to the tube, and I'm gonna aspirate, okay, to facility policy and doctor's orders. If it's how many mLs, if it's less than 200, we can continue the feeding, but we need to color and consistency of the aspirated of the residual, and return the residual back, okay? So we need to do that. If we don't aspirate anything, then it needs to be checked with the x-rays. So once we're done that, we need to flush. So then I'm going to return the residual, and I'm going to proceed with the feeding. So I'm going to flush 30 ml. So I'm going to disconnect the syringe. So I take up the syringe, right? And I'm going to remove the plunger, because I'm not going to need the plunger. So I take out the plunger, and I'm going to flush here with 30 ml of water. So I'm going to get 30 ml of water, and I'm going to flush. Once that is done, okay, now I'm going to pour the formula, okay, to make sure that it goes in. So like this. Okay, so once, let me see, first, okay, the formula. Just gonna get a syringe, okay, I disconnect the syringe already, right? Okay, and remember all of this needs to go down by gravity, okay, by gravity. So the way that I'm preparing the formula, open it here, the formula is gonna go here, okay, and I need to now remove my gloves and administer so that I can get on the machine. I can remove my gloves now and continue with the feeding. Okay, so now once we did the flash tube with the 30 mLs, then I'm going to, what did I do? Disconnect, and it's connecting now. I remove my gloves and I administer the feedings. Okay, so now if I'm gonna administer now the feeding with an open syringe, then I need to make sure that I remove the plunger from the this is not 60 ml, but remove the plunger from the 60 ml syringe, right? And now here, I'm gonna pour the pre-measured, okay, the pre-measured formula, and then I'm gonna need to open the clamp. I need to open the clamp, right? Sorry. Okay. So that the formula can go in here. When you go like this, it's by gravity. So the height, the rate will be controlled by the height of the syringe. Okay, so then once we do this, okay, remember to add 30 mLs of water to flash as well, okay? And so once we do that, we need to assess the stomach again. Do we hear any gastric movements? And we need to do that at least once every shift. So now we have the patient remain sitting, Fowler's position, high Fowler's, for another hour because they're feeding, right? So they need to be sitting up like that. Okay, so now remove PPE used and gloves, everything, and perform hand hygiene. So I perform hand hygiene again. And now we're going to administer medications. So now administer medication. So the medications, if it was a pill, we needed to crush it and make it all into powder, and with the correct amount of water to pour on here to mix. And then the other one, if it's a liquid medication, we need to then hold it by the palm, and we need to make sure that we have the correct one. We could do this where we have the medication room, outside the patient's room, and we check, when we pour the medicine, we need to check the meniscus, okay? So once we pour, check the meniscus, make sure it's the correct amount, get a paper and clean the tip here, then close. Okay, and here we need to make sure that we have, so let's say we have let's say that this is the paper mark, right? Because we already checked the odors of what we needed, and we check the mark and make sure we compare with the medication that we have, okay? And the label of the medication that was already here, okay? So compare the label, make sure it's the correct one, and we can do the check before we go into the patient's room, the third check, but we can also do a third check once we go into the patient's room. So we go into the patient's room, okay? We perform hand hygiene. And we need to check their ID bracelet, and name, date of birth. And again, before we give the medications, again, we're going to check that we have the right medication, and each one is going to be separate, okay? Each one is going to be separate. We cannot mix the medications. Okay, so we identify the patient, we explain the procedure, what we're going to do, and what the medications are, and now we're going to provide privacy. Okay, so after we provide privacy, I'm explaining everything to the patient. The patient needs to be in high powers position and elevate the head of the bed and elevate the bed to work in height and make sure that you know, I'm gonna need to get this, okay, because I need to now disconnect the tube, right? I need to identify the patient. I already did all of that, and I need to complete the necessary assessments that I need. After I do that, I need to check the patient's allergy bracelet as well. Check, do they have any allergies? If they don't, okay, we continue, and I need to now complete and do an assessment and check the patient's allergy bracelet again, just to make sure that everything matches and that they don't have any allergies. Once the patient is already in high powers position, then I need to put on my gloves. Okay, so put on my gloves. I'm not gonna put on because they're all they're like powdery. Right? So, okay. So now I'm going to pour the water. So I have some water that I'm gonna pour so that I can do the irrigation, okay? Flush or irrigation. Okay, and I need to apply the clamp. Pinch the gastric tube, okay, because below that port, so that, and then I'm going to open the port for the GT for the meds. Okay, there's one for the meds, and I open the port for the meds. And once that's done, I need to now disconnect the tube for the feeding, because we're not going to do the feeding, right? It's going to be the medication. And I need to check tube placement. So I'm going to do that. I'm going to get residual. So I'm going to check the residual and make sure that it's less than 240. Make sure I check the color consistency, and I need to return that as well. Okay. So once I do that, I need to remove now the thing back and cap it, and I need to remove the syringe, and I need to put 30 mLs of water. Okay, once it goes down by gravity, right? Then I'm gonna be able to put one medicine at a time. So then I put one medicine, and I follow with only 10, okay, 10 mLs of 5 to 10 mLs of water, okay, and let it go down by gravity, right? And then once that one's done, then I need to do the other one. The other medication, and another 5 to 10 mLs of water. Okay, so once I finish all the medications, then it's gonna be from 30 mLs to 60 of water, and let it go down again. And once it's all done, we need to remove the syringe. We need to clamp it, okay, and replace the feeding tube or the tube medication, whichever one was, okay, unclamp the G tube and restart the feeding if it was another feeding that was already there to continue the feeding. Okay, so now I can remove my gloves, okay, and any PPE that was used, bed to lowest position, comfort the patient comfortable, or if they were feeding, they remain up, and remember the 4 Ps again. So once we finish with 4 Ps, make sure that we check how the patient is doing, and we need to come back 1 hour later to check, or whenever appropriate time, to check on the assessment. Okay, so now after we assess, we're going to assess the next time that we're done with the administration of the medication. So now we're going to remove the NG tube. So to remove the NG tube again, we need to check the orders. Okay, so what is it that we're going to use? Okay, so we're going to take a medical order. We're going to do hand hygiene, identify the patient, okay, explain the procedure to the patient, and provide privacy. So after we provide privacy, we need to have the bed the head as well, assist to 30 to 45 degrees. And then we're going to place a towel. We have this towel here. I'm going to place this towel right here, like on the chest. Alrighty, so that we can have also some Kleenex and an emesis basin for the patient to use. Once that is there, we need to make sure that I unpin. So we need to unpin this tube, and we need to remove the tape from the nose so that there's no more tape. And we need to make sure that we disconnect the suction. Also, we need to make sure there's no other suctioning thing going on in the back, and this is like our suction container in the back. Alrighty, so make sure we do that. So now, once we do that, we need to coil this as we're getting it, and we're going to tell the patient to take a deep breath. So, okay, make sure that right now we already have our gloves, so we put on our gloves. Okay, so we put on our gloves after we give them all the supplies. We need to coil this, tell the patient to take a deep breath. So take a deep breath. When they take a deep breath, then we remove quickly and carefully, making sure that all of these things are staying here with the patient. So as we're doing this, okay, then we need to put everything here, make sure that it doesn't go all over the place. And once it's like this, remove everything like this, okay, and put away. I remove my gloves, put the patient in a comfortable position, lower the bed, put the side rail up, okay, and make sure that I removed everything that I have, throw away. So now also provide something for the patient to clean his nose and he needed the emesis basin. They were good. Okay, so then now we finish with that. Okay, remove the equipment, put everything away, and now I'm gonna go check the container. Okay, so I'm gonna put another set of gloves so that I can go check. Okay, so I have my gloves on and I need to go check the container that's there. So I need to measure the amount that's in the container, and after I measure, I need to add, there's a solidifying agent to make it solid, and I need to dispose of this properly. Once I dispose of this properly, then I need to remove my gloves and any PPE that was used and perform hand hygiene as well. And I think that's all. I make sure that I document how the patient tolerated this procedure, right? So now that the patient already has everything here, now it means that the patient, we did the last assessment of the abdomen, and now there's bowel sounds present, there's gases passing or flatus, and now the patient hopefully will be able to recuperate and be able to have oral feedings. Okay, thank you, and see you later. Bye.